So my main clinical focus is acupuncture, and I use it a lot every day in my treatment protocols, especially with any physical pain. Today, like I said, we're focusing on the upper neck and shoulders. I actually don't really needle the neck too much when it comes to neck pain because I find that it's a little bit too hypersensitive, but also there's just so many muscles, superficial muscles that are inserting or originating from the neck that I can actually just treat the shoulders mostly instead. So traps, rhomboids, supraspinatus, all of those I can actually treat a lot, and that's more of a back treatment, which I will show just in a little bit. I enjoy doing face-up treatments first. The treatment protocol that I end up doing is more constitutional. I do about 8 to 9 needles when they're face up, and then I let them sit for about half an hour, and then I flip them over, and then I do a nice back treatment just to finish it off as well. Before I needle anyone, I do make sure I go through a thorough history, make sure that they're comfortable with needling, and I want to check out their range of motion as well. The reason for that is because some of the acupuncture points that I'm choosing can be really specific on whether they have poor rotation or restricted rotation in the neck versus if they have restrictions in extension and flexion. So if they have extension and flexion restrictions, then I'll needle bladder 65, which is actually right at the on the lateral side of the foot. And then if they have any rotation restrictions, then I will needle SI3, which is just on the lateral side of the hand right here. And then at that same time, I can actually feel around, see if they need any joint mobilizations, and then send them off or refer them to a chiro if they don't have one or if they already have one, or I can do it myself if the time suits. So with the or the face up treatment, I actually end up only needling 8 or 9 points. So on the right hand side, I usually just do Sanjiao 10 and 3. If they have any low back pain or if they have any more gallbladder-ish meridian pain in the shoulders, then I may do Sanjiao 3.5, which is just halfway between 3 and 4. On the lower leg, I'll do the liver meridian, so on the right side, so I can do liver 8 and liver 3. Also, because, and you'll see in the previous video on low back pain, I mirror a lot, so the neck and the shoulders actually mirror along the liver meridian on the lateral side, close to that ankle joint as well, so it's a really great place for me to needle. On the left-hand side, I do gallbladder 41 and 34, and then on the right or on the left-hand side of the upper extremity, I'll do the PC meridian, so 3 and 7. It's actually really nice to do the PC meridian as well. I don't really needle PC6 because of the balance approach that I'm using. However, if I can needle about 6.5, which is halfway between 7 and 6, it's actually a really great point to stimulate, to be able to help with insomnia, any anxiety, or a lot of stress. And that's a major part of this protocol, is to make sure that the stress and the muscle tension is relaxed and really relieved, because that actually makes the neck pain way worse. And that's something that Beth will probably go through as well. Right? So I want to make sure that the muscles and the mind are as relaxed as possible. So I can actually show some needling. I'm just going to do the upper extremity here on the front side. Is it okay if I needle you, Beth? Mm-hmm. All right. So remember Sanjiao 10, just above that olecranon there, about 1 ton, and then you can needle it through. How's that first needle?
It's good.
Nothing too painful or anything too crazy. Things I tell my patients while I'm needling them, I always want to check in to see how they're feeling. If there are any points that are a little bit too intense for them, the only feeling that I don't want them to feel is as if they've been stung by a bee, or if it's an electrical shooting pain, that just means I either went into a follicle or I've hit a nerve. Neither are very comfortable, so I'd rather not let them sit there for half an hour. The hand ones tend to be a little bit more sensitive than all the other parts of the extremities, just because you have, what'd you feel there?
That was just weird and twingy.
Right? So that's a very common thing that I hear from my patients as well. Oh, it's like really weird, it's numb, it might be like a whooshing feeling. So those are really common sensations for my patients to feel, and I just want to make sure that those are the only sensations that they're feeling. On this hand here, if we're looking and they're palm up, up. This is usually a comfortable position for them, and then I can actually get into the PC meridian, which is just midline here. I find that PC7, which is between the two tendons right at the first wrist crease, is actually a really great point for neck pain. And then PC3 is just at the elbow crease here. You can needle anywhere along here to balance out any neck pain. You just want to feel around to see if there's any resistance more than the other. And for Beth, I'm feeling here is quite soft and supple, and then once I get about a ton above, there's that resistance. And Beth, you might even feel that there's a little bit more of tension in that area. So then that is where I would needle.
That one feels good.
Yeah, right? And then I would let them sit like this for about half hour. I could actually add some ear acupuncture points just to really help with stress management, and that's going to be ear shen men or parasympathetic. It's great because in this position you can pretty much do whatever you want to really hit on any of the constitutional areas or issues that they're having, that if it's not just neck pain, if it's something else, you can have a full range of where you want to needle with them face up, which I really love. And then now we'll flip over to the back treatment, and then I can show you some electrostim that I love doing and some other extra points that really help with sleep issues and stress management as well. Now, after half an hour of being face up, I get my patient, I take all the needles out. Make sure you take your needles out. You don't want them to turn around and then lie on the needles. It's not a fun time. And then now I'm going to do a prone treatment where I'm focusing mostly on rhomboids, maybe even like upper fibers of that traps there. I'll needle a little bit in the cervical area. It's actually really tough to get deep enough to get any of the cervical muscles. They're mostly superficial. I mean the deep cervicals. I highly recommend not trying to needle those. So that's why I end up doing a lot more treatments in the upper back, because that helps a lot in relieving the tension in the neck itself. So there's not necessarily any true acupuncture points that I'm needling. It's all ashi points, although we can landmark around to see where we want to needle. So up in Beth's left trap here, it is quite resistive. There are quite a few trigger points that I'm feeling. Around gallbladder 21 is where I'm feeling mostly. So then we can needle there. What I find mostly is if the upper trap, there's going to be some resistance or any myofascial trigger points, then I find supraspinatus will also have one, which right there for Beth there. And then I find that infraspinatus will also usually have some trigger points that my patients didn't really know they had. So for Beth, it's right there. And then I will needle some in the cervical region as well, just feeling for, again, those upper trap fibers. And then she does have a vertebrae that's a little subluxed on her left side here, but there is a lot of soft tissue that can be done. So I would needle here. And say if my patient, so if Beth mentioned that she had trouble sleeping, she had insomnia, there's a lot of stress going on, then what I can actually do is there's this wonderful point called Anman. It's pretty much between Sanjiao 17 and gallbladder 20, right on the posterior border of the SCM there. And then we can actually needle both sides as she's lying face down. All right, so because I do usually do this bilaterally, but for this video, I'll just do just the side that I was palpating. So what we will do is we end up using way longer needles than we usually do. For most of my constitutional needles, I usually use a 0.25 by 0.25, but for more deeper needling, or if I want a greater area of effect, then I end up using a 0.25 by 44 millimeters, so they're quite a bit longer. So like I said, we are going to be palpating around gallbladder 21, see where that trigger point is. You want to grab that trigger point. You don't want to let it loose, and you don't want it to move everywhere. You want to make sure that you localize it and you get as localized as a treatment as possible. We needle perpendicular first, just a little bit, and then you change directions, and you want to make sure that you are going parallel or away. You don't want to do deep needling in this area, just in case the apex of that lung is pointing up a little bit higher than normal, and then you give them a pneumothorax, which is a big no-no as well. Your patients don't really enjoy going to the hospital either. And then, like I said, supraspinatus, we can needle here. And then you're just tractioning through. You want to find where there's most resistance. A little bit like, what is it? It's a little bit like IMS, but not as aggressive. And then here, if I am needling through rhomboids, you're going to catch the rhomboids through here anyways, so you can actually do an S to I needle, and then you can aim for rhomboids and the erector spinae at the same time, so you can come down through here like that. And then I'll put one more for demo purposes as well. What you can do in the cervical neck region is you can either do a longer needle and then just thread it all down through, or you can do multiple shorter needles, whatever you feel the most comfortable with here. And then we just thread it through all the way down. I never will put e-stim into the cervical region ever, and then you never want to have electrostim cross the body or cross the central nervous system at all. That's a big no-no. You always want to have everything only on one side. So then this is my e-stim. I usually do a mixture of alternating pulses, so between 2 hertz and 30 hertz, and then and you will see on the camera once I turn it on that you will see a involuntary movement of the shoulder. And Beth, just don't fight it. And then I want to make sure that you see it on the camera here. All right. So like I said, it oscillates or alternates between 2 hertz and 100 hertz. We just want to, both of those actually help release enkephalins or dysorphins, which are really helpful in reducing pain and having a long-lasting pain management. But also what I find is it essentially works out the muscle so much where it will relax it out. So the longer the treatment is, that's why I only do it for 10 to 15 minutes, because by the end of that time, when I come back and check in on my patients, the shoulder's not actually twitching anymore. It actually is quite relaxed and it's not moving as much. And that's just because you're essentially fatiguing it out as much as possible. And that's what I want. I'm forcing a relaxation of those muscles. So Beth, let me know when you feel anything at all, like a tingle, literally anything.
Yeah, I feel.
Okay, perfect. So I'm going to turn it up to a point where you're comfortably uncomfortable.
Oh, great.
And then you might, sometimes you will only see the needles moving, and then you won't see the muscles itself moving, but you have to go by what the patient is saying. So how are you feeling there?
That's interesting. I like it.
Yeah? And then I'm going to turn it up just a little bit, and then you can see that, you can actually see her muscles twitching and moving now. It's quite involuntary. It's quite a weird feeling, right, Beth?
It is, yeah.
But it's not painful at all. Like, what do you experience?
It's like just really deep, fine vibrations.
Yeah, so it feels like it's vibrating you essentially, and that's a wonderful way to explain it. Vibrations is a wonderful way to actually sedate your muscles. In some instances, I was reading that they will actually vibrate the table pre-surgery just to help sedate their patients. So it's really similar to the same thing. So I'm trying to vibrate your muscles to sleep. So I can turn it up, I can turn it down. I want to make sure that the patient is as comfortable as possible. And then, like I said, I'll leave it for 10-15 minutes, and then their muscles will be nice and relaxed, and then I can send them on their way. I love ending my treatments with some good e-stim.